Hi folks, I'm Dr. Tony Nesterenko. I'd like to welcome you to our website. Today we're going to talk about fibromyalgia and chronic fatigue syndrome. Now, brain-based therapy was discovered by Dr. Frederick Carrick. He's a world-renowned neurologist and the only neurological chiropractic fellow in the country. And what Dr. Carrick found was that these patients that suffer from these chronic conditions such as fibromyalgia, chronic fatigue syndrome, migraine and cluster headaches, and an array of other problems had suffered from one of three things: emotional stress, chemical stress, or trauma. Emotional stress, we're talking about, a person been under long-term stress from a job or a sick family member. Also, anything of long-term stress. We're not talking about a few days, we're talking about months or years of stress. Also, there's such thing as chemical stress. Chemical stress is smoking, drugs, alcohol, over-the-counter medications. They also decrease firing of the brain. And trauma, of course. You can have a car wreck or a fall and cause decreased firing of the brain and lead to fibromyalgia, chronic fatigue syndrome, and an array of other problems. So let's talk about the emotional stress. When you're under emotional stress, your body, your adrenal glands sit on top of your kidneys and they release cortisol in your bloodstream. Cortisol is toxic to the brain. So what it does, it decreases firing of the brain, which in turn causes the upper brain stem to become overactive. It begins to overfire. And what we find with these fibromyalgia and chronic fatigue patients is that upper brain stem's overfiring, and symptoms that they have are chronic fatigue, chronic pain. It moves around. Sometimes it can start in the neck and shoulders, and it moves throughout the whole body. Some of my patients are so bad that you just touch them. Their skin, just to touch them hurts. That's how bad they are. When over a period of time, after this thing has been going on for some time, it gets to that degree. Also, they have increased warmth or sweating, light sensitivity, constipation, alternating between constipation and diarrhea. Sometimes some of our female patients have urinary tract infections. Quite often with this, that's a sign of the upper brain stem overactive mesencephalon. So what we do with these patients is we use brain-based therapy, and I was trained by Dr. Michael Johnson, who wrote this book, What Do You Do When the Medications Don't Work? A Non-Drug Treatment for Vertigo and Dizziness, Fibromyalgia, and Migraine Headaches, and Other Chronic Conditions. Now, Dr. Johnson suffered from chronic migraines, and he became a patient of Dr. Carrick's, and Dr. Carrick got him well, and Dr. Johnson had tried everything. He'd suffered for over 15 years with his migraines and tried many different chiropractors, about 20 different chiropractors. Some helped him, but he never got well. Well, since going through Dr. Carrick's program, he has not had a migraine in, I believe, over 15 years now. So I got into this program because I suffered from a chronic condition. I was having chronic insomnia. I was having like fibromyalgia symptoms, bilateral arm pain, chronic fatigue, also having temperature problems. My left hand and left foot would be cold all the time. Mainly, also was having some migraine headaches. So brain-based therapy is what got me well, and that's how I got into this program. And I've been using brain-based therapy over 5 years now, and I've seen a number of fibromyalgia patients that have been sick for years and years, and we've been able to get them better. Also, chronic fatigue patients, it's the same thing going on with them. That upper brain stem's overfiring. You have to slow that upper brain stem down. Things that we use with that to get this problem better is oxygen. Use oxygen and upper body ergometer. We also use unilateral adjusting. We adjust you on one side of the body, and we determine that by neurological testing. That you cannot go to the chiropractor and get adjusted on your right and your left, your right and your left side. You'll never get better. You may get some temporary neck or low back improvement, but you're never going to get this problem corrected that way. You have to check a person neurologically and find out which side the cerebellum's not working and which side the brain's not firing on. And we do that by all neurological testing to determine that. We also use things such as auditory stim, auricular therapy, warm water caloric in the ear, eye exercises, olfactory stim, just to name a few of the things that we use. And this program, if you follow through with it, we do this every day to get this brain firing again and get it working again, slow that upper brain stem down. And what will happen, you get to start sleeping again, relaxing. You won't have that anxiety feeling any longer. That light sensitivity a lot of patients suffer from also is that cranial nerve 3 is not constricting the pupil when you get in light and you want to wear glasses or you always want to shade yourself away from light. That is the brain on that side, let's say the left pupils. You're getting light sensitivity and that cranial nerve is not constricting that left pupil. That means the left brain's not firing. And there's 5 million people diagnosed with, on the average, with fibromyalgia, and there's 10 to 15 million out there that go undiagnosed. And your medical doctors say you have to have 11 of 18 trigger points to be diagnosed with fibromyalgia. Well, folks, that is not true. You don't have to have 11 of 18 trigger points. That doesn't really matter to us. We check you neurologically, and if you have some of these symptoms that we see with our neurological findings, like balance disorders, if you close your eyes, put your feet together, folks, and you're very off balance, you have light sensitivity, increased frequency of urination, also have increased warmth or sweating a lot, stomach problems, diarrhea, constipation, irritable bowel, anxiety, irregular heartbeat is another symptom of this, of the upper brainstem overfiring, overactive upper brainstem. And what happens is the lower brainstem can no longer slow the upper brainstem down, and that's what happens. Also, the mesencephalic reticular activating system, which controls your sleep. Your mesencephalic reticular activating system should be firing at its highest at 3 p.m. in the day and its lowest at 3 a.m. Well, what's happened here with these patients can't sleep at night, and then they want to go sleep in the middle of the day. They're flip-flopping, and that's a sign of the upper brainstem overfiring. And when you get this brain-based work, and we'll work on you, put you on oxygen, upper body ergometer, and adjust you unilaterally and use these therapies on you folks, you'll get back to sleeping again in the middle of the night. You'll get back to relaxing like you're supposed to. The irregular heart rate and tachycardia will slow down. The headaches that you may have, tension headaches with this fibromyalgia, is another sign of that. It will slow down. So folks, this problem will ruin your life, and your medical doctors continue to put you on sleeping pills, Lyrica, and it's not an answer. My patients have done every bit of that. I've seen them, have had it for years, and they have tried everything under the sun and with no results until going through brain-based therapy. So folks, if you're interested in changing your life and getting your health back on track, and just folks, you can't buy more time on your life. So it's time to get your health better. We'll get down to that. I know you're frustrated. You tried numerous other things, everything under the sun, and no results, and spent countless amount of money. Folks, this is the reason for fibromyalgia. This is the reason for chronic fatigue syndrome. This is the reason for migraine and cluster headaches. And these chronic conditions these medical doctors cannot fix is that upper brainstem overfiring. Dr. Carrick figured this out, and it works. So get yourself in here, give us a call. We'll run some neurological tests on you, and we'll see if we accept your case. If you qualify for care, we'll talk to you about that and get you a program set up and get you back on your way to better health and enjoying your life again. Thank you.